All right. Well, good morning, friends. Good morning. Good morning. My name is Dr. Christine Whelan, and I am filling in for Dr. Malia Jones. And I'm a nerdy girl with a background in wellness and translational academics, talking about how to stay happy and sane in the last year and beyond. And I'm hosting today, and I'm joined today by a co-nerdy girl, Dr. Ashley Ritter, the Chief Clinical Officer of Dear Pandemic and a geriatric nurse. So Ashley's background and work focuses on aging and healthy transitions. So good morning, Ashley.
Good morning, Christine. Happy to be here with you today.
Oh, I'm happy to have you on. This is going to be fun. What we're going to do today is we are going to answer some reader questions. We are going to we're gonna have a good conversation. We're going to try to post some links as well in the Facebook Live so that people can follow along and look at citations as we go. But I mean, let's kind of get right into it. It's been kind of a good week in many ways in terms of vaccination news, right? We hear some good news from Pfizer that there are some positive results on testing with 12 to 15-year-old kids and their Pfizer vaccine. And yet at the same time, there's some concerning news with some rising rates and lots more variants spreading around the United States. So what are you thinking about this week? What's going on with you?
Well, I was thrilled to hear the positive news. I think that it's been a really hard year, and this was a really great week. So with that, I would say that my take comes from a common theory in geriatrics, where we start low and go slow when we're recommending new medications, new therapies, new treatments. And I'm celebrating the small but important improvements in daily life. So, for example, my kids returned to in-person school 4 days a week. Huge deal in our household. They've been home in over a year. I picked a skirt out from the fancy side of the closet to go to work on Tuesday, which is something that I wouldn't even considered a few weeks ago. I was able to visit one of my residents in a nursing home where I have not been permitted for multiple months. And many of my patients received their vaccine doses this week. So after a year of waiting and some really strict no's, I'm really grateful that to have some of these very little things, but very important things. And I am doing my best to point out these small but important milestones to my family and my patients, because I'm also a little nervous. We really need to proceed with caution. Most people in the United States and internationally continue to wait for their vaccine. Now is not the time to let down our guard and jump back into all things. And that's why I say start low and go slow. Cases are rising in many areas, and where we're plateauing is above a level that would be optimal to prevent recurrent surges. So we need to be patient. We need to get vaccinated when it's our turn and watch the infection trends around us. But most importantly, keep the faith. How about you?
Absolutely. This has been a good week for keeping the faith, I think. For me, yes, I actually put on jeans this week. I mean, with better or worse results, but anyway, there was the move into that, and for me, the good personal news was that I got my second vaccine this week, and so I'm feeling good on the other side of it, and that really gives me some renewed hope for the future. But before we get too deep in, I did want to call out a real special thank you to Bridges for the Deaf and Hard of Hearing for providing closed captioning by Lucinda Plexico. And usually we have ASL interpretation, but we don't have that this week. They will rejoin us next week. So we're sorry about that, but hopefully we will have that next week. And if you are enjoying these services, please say so in the comments. Knowing that people are using it really helps us keep going, and we love to get this information out as widely as possible. So now, just a reminder as we jump into some of the questions, we don't take questions cold. So if you have a question, you can submit it in our question box, and that's off of our website, which is dearpandemic.org. And while you're there, you can also search and see if we have answered your question. I have been using the search feature in the dearpandemic.org site a lot this week, and it's really very easy to use, and quite fun. And now is the time when we have all these questions that maybe we had at the beginning, a year ago, and now we're wondering, as we're doing that pandexit, as we're moving out into the next phase of the pandemic. So some of those questions from before might be arising again. But let's start with one of the questions from our question box recently. Lindsay from New Hampshire asks, rates of colds and flus are way down this year, and that's a good thing. So should masking last beyond the pandemic? This is kind of cool. Dr. Ritter, to you.
Well, we all know that I love the mask beat. I love answering questions about masks. And as a mom of elementary school kids, a daughter of an organ transplant recipient, and a provider of care to older people, I vote yes, masks work. I think that how we would use masks would be a little bit different moving forward. But when I think of the benefits of masks, I think of a couple categories. The first is morbidity and mortality. So respiratory illnesses are a significant threat to people at extremes of the age spectrum. So little babies, young children, you think of RSV, and older people with pneumonias and the flu. But there's also many individuals with chronic underlying illnesses that are at high risk of complications from respiratory viruses. And we saw massive drops in flu and RSV diagnoses, as well as associated deaths this year in the setting of wearing masks and social distancing. And there could be debate over, is it the masks or social distancing? It's probably a combination of both, but masks are a really great source of source control. And depending on what type of mask, can really stop the inhalation of particles. And so they have been effective. And I think that there's a large body of research that shows how effective they have been in not just preventing COVID, but preventing some of these other respiratory illnesses. But even if the flu doesn't kill you, it's really disruptive. So if you think about the days off from work, the lost productivity, interrupted childcare, requiring medical care, and the medical costs for many who don't have access to these services or the money to pay for those visits, the flu can be really disruptive. And so not having those disruptions or decreasing disruptions, by wearing a mask could be a great intervention to reduce the spread of things we know are common, costly, and deadly to some. So if we thought about how you might think about masks moving forward, I'd like to think about the when and the where of a mask. So you could think about seasonal use to strategically target times of year that we know are common for respiratory illness spread. And that varies, depending on the hemisphere that you're in and what commonly circulates in the area that you live. You could also think about masks as something that was essential in crowded public spaces, such as airplanes or mass transit, or large gatherings to decrease risk when it's hard to space out and otherwise avoid risk. And the third is, thinking about wearing a mask when we're not 100%. Certainly in the United States, there's a sort of a culture of we must keep going and going, and people go to work sick. Children go into school when they're not quite 100% yet, and so wearing a mask could reduce the transmission of germs when we're not quite 100%. If we can stay home, we should stay home. And I also like to think about masks as sort of an equity intervention. So masks consider the needs of everyone to promote more robust, engaged communities inclusive of all. And so when I say that, masks lift the floor for people who are unable to participate in a world with high levels of circulating pathogens, such as people with underlying chronic conditions. So if we're wearing masks and normalizing that practice, it takes the social responsibility off those who are most affected by others that are not wearing masks. So I'm a fan. I think that we should really critically consider where masking makes sense moving forward. I don't think we're going to be wearing masks all the time, all places. But I think that they have a very valuable role in respiratory illness prevention in flu seasons of the future.
Yeah, and would you ever wear them when visiting older relatives, for example, as a sort of a courtesy and a way of saying, I'm trying to protect you?
Yes, I think that this would change infection control around visiting older people, people with chronic illnesses. So my father had a kidney transplant about 2 years ago, and we wore masks around him shortly after transplant because he was at such high risk. And I think he would have looked at us funny if we showed up in masks now. In the future, I don't think he'll look twice at us to put a mask on.
Yeah. Plus, we've all gotten so many of them.
Yeah, but even in the nursing home, nursing homes, at least many nursing homes, are reaching a point where many of the residents are vaccinated. The staff are still wearing masks, and you might think of, are masks going to be something very consistent in healthcare settings moving forward? As sort of a standard precaution while respiratory illnesses are circulating. The virus gets into communities from the outside generally. And so it's a good intervention. It's not invasive. It's not extremely expensive. We should consider how effective it is and apply it to the places that it makes sense.
Absolutely. Absolutely. Well, I just got a new spring mask. That was all, it has pretty flowers on it stuff. So I'm kind of excited about that. That's a really, really helpful, excellent and detailed answer to the question about masks. I'm going to switch gears a little bit to vaccinations in kids. So Mandy from Grapevine, Texas asks, as more parent households are fully vaccinated, please, please, please address kids and COVID. Real data from moderate to severe cases of COVID in kids. Many of my friends feel that once they're vaccinated, they will get their families out and about. They think that if kids are outside, that's protection enough. Is this true? Do you think kids will still be wearing masks? Do you think when they start school next year?
Well, that sounds like 3 questions to me. So I'm going to do my best here. And I want to reframe a little bit. Kids are part of society. Kids can get COVID. Kids can spread COVID. And the goal at this moment in time is to stop the spread of a dangerous and disruptive virus with the capacity to mutate and cause a whole barrel of new issues. So kids are part of the spread of COVID, and we really need to treat them as unvaccinated individuals, while preserving things that are really essential to the functioning of children. So unvaccinated kids at this moment in time do need to maintain smart precautions. So ensuring that there's space, wearing masks, increasing air circulation, such as moving events outside or using filters, restricted networks where they're not having multiple contacts with multiple different groups, and if a visit can be shortened, to shorten that time. Because most people are not vaccinated. We have a bit to go, but we are going. So when you make plans to get out and about with your kids, you want to think about what an infection would do to your household, but also to the households of others. So if children get infected, while they might not become incredibly sick, it's going to put a family into a situation where they need to quarantine, preventing them maybe from going to work, and being able to, and being locked in your house for a few weeks with your children without any outlet. So we've all done that for a bit of time. We want to try to prevent that in the future, or at least I do. It would put you into a position where your children might be missing school, something that we have waited a long time in many places and still have not achieved in some places for them to return to school settings. And there's the risk that your child could infect others. And so all of those add to like a collective burden to society of shutting down schools, shutting down summer camps, and really just dragging out this not ideal situation. So, I think the things that we can do is vaccinated adults decrease the circulating virus for kids to get infected. So adults should go and get vaccinated, and that will help virus circulating levels be lower for children, so that children are able to have a little bit more leeway. And the second thing is, when vaccines are available to your children, sign them up. But until then, we do need to maintain those smart precautions.
Yeah, it's so tempting, because for those of us who have children, right, if the parents are vaccinated, we want to get together, but we're still not at the point maybe where we can get a babysitter. So then, of course, we bring the kids along, and then we have all the vaccinated parents and the unvaccinated children. And we have to remember that when we look at the CDC guidelines around this, these children are people too, right? So they are considered unvaccinated people in the mix.
Yeah, it's not easy, but just having the peace of mind that we're getting to a point where people at higher risk are vaccinated really is, a beautiful thing to be able to start expanding networks slightly and having adults come over that are vaccinated, being able to be outside with groups where maybe many of the adults are vaccinated and you're with one other family and you're maintaining precautions, we are well on our way. The end is in sight, and we need to just sort of stay the course.
Yeah, and with warmer weather on the way for a lot of the United States,
exactly,
the world in general, that I think that's going to make things easier too, right?
Definitely. I have a question for you, Christine. Several readers asked about what to do with their vaccine cards. Their vaccination cards. And on Monday, we posted some guidance. What were the key takeaways about managing your vaccination card?
So yeah, so we get this little white card, the CDC vaccination record card, right? And the idea of getting a piece of paper in the digital age, right? That we don't know what to do with it then. So on Monday, we wrote up some do's and don'ts. And they're fairly loose do's and don'ts. Really, there's some just guidance on best practices for what to do with your vaccination card. The first thing is to treat it as an important medical record and to make copies of it. So even after your first vaccine, when you get that first little card, just take a picture of the front and back of it. If you have an iPhone, you can use the notes function, and there's it's almost like a Xerox copy kind of way that you can take a picture, but just take any snapshot of it. And then when you have your second vaccination dose, instead of doing what some people are doing, which is laminating the card and putting it in their wallet, I think the better thing to do at this point might be to make that copy, print out a copy, and put the copy in your wallet and put the original in a safe place with things like your passport and your social security card, places where you wouldn't lose it. Now, if you do lose this vaccination card, don't totally freak out. There are digital records, hopefully, behind that little piece of paper. And most vaccination sites, well, all vaccination sites are required to send their information to a state registry. I have heard some stories from people where their vaccination records haven't gotten uploaded quite yet, or there's been a mix-up. So that's where the actual card does come in handy. And the other real encouragement is to send a copy of the record to your healthcare provider, to nurse practitioner, to your primary care physician, whoever provides your healthcare, so that it gets into your healthcare chart. And then in terms of things not to do, well, so much of our social information is up on social media anyway these days. But if you want to post that selfie, I have noticed with my own vaccination card that if you hold it in your left hand, your thumb will actually cover your last name and your date of birth, and then you can post it up there, right? So it would get rid of at least some of that identifying information. But the key thing is to treat it carefully. I have heard of people using it as a bookmark. That was something in one of the comments. Probably best not to use it as a bookmark. You can use the copy as a bookmark if you'd like, and carry it with you. Carry that copy with you, because we still don't know how those vaccination records are going to be used in the months to come. But you want to hold on to yours just in case.
That's great advice, Christine. And the lamination it feels like such a good idea, but if there's ever a need to update that card in the future, it's very hard to write on a laminated document. So I thank you. And I've taken a couple notes about what I need to do with my card. So thank you.
And everybody's been asking me about this week, so I've been sending out our Dear Pandemic post far and wide, which is it's good, just good practical advice, which is, I guess, what we try to do at Dear Pandemic.
That is absolutely what we try to do, and we thank our community for giving us the questions. We couldn't answer good questions without getting good questions. So thank you.
Absolutely. And speaking of good questions, I have to ask the big question on many parents' minds this summer is what about summer camp? So summer camp is one of those things that, whether it's sleepaway camp, whether it's day camp, is very much a part of the way we think and plan for summer. And I know it's only the beginning of April, but a lot of us have been thinking about summer camps even since January. So Dr. Ritter, tell us, what is your guidance on day camps, sleepaway camps, pools, what we can and cannot do in warm weather this summer?
I'm going to do my best here again. No tomatoes, everyone. But I would say that this summer will be better than summer of 2019. Will be better than last summer, but not quite summer 19. So we had a year to figure out some mitigation measures at summer camps. Last year, there was a lot of trial and error, seeing what worked in camp settings. The other benefit I think we have this summer that we didn't have last summer is that more adults are vaccinated, and that number is increasing every day. We also have vaccines for kids on the horizon, but they're not going to be here this summer. And so we need to be careful in the things that we're doing. So I'm excited that I believe there will be things open. I believe that we're going to work out some of the mitigation measures that were sort of a crash course last summer and hone those a little bit. But we really need to think about what we're doing and why. And I'm also going to lay out my biases. And so if I'm saying something that's not consistent with the experiences that other people are living in, please, this is where I'm coming from. And I try to think broadly, but it's sometimes not easy to think of the shoes that other people are living in. So I have young and typically developing children at home. They have childcare in our home, and our parents are vaccinated. So my kids are home. They're little. They are relatively unfazed by the things that are happening. And by me keeping my kids home, I'm hopeful that there's room and services for other children and families that might desperately need some support. I don't want to minimize at all essential needs for children, adolescents, teenagers, childcare, work requirements for adults. So I try to keep my kids where they are so that those services are available. But I know that this is a really hard thing to navigate, particularly when there's childcare needs involved, essential developmental needs, and getting to work every day. So I'm staying home. My kids are staying home. They're going to be fine. And next year, we're going to join up in what we can join up in. But when I'm trying to sort of weigh out and giving advice to others, I think we need to consider, so what's the need and what's the want? We need to prioritize safety, and we need to prioritize those essential needs. School is essential. In-person health and social care, like occupational therapy or language therapy, is essential. Day camp during working hours may be the only way to obtain childcare through the summer, making it essential. And we need to return and to maintain to those essential services before we seek activities for enjoyment. So if you can skip the non-essential stuff, like big parties or extracurriculars, maybe hold off on those to maintain what's essential. And when we're doing that, we need to hold those activities accountable to risk mitigation practices. Again, this is not the time to let up on some of those. So the first thing we'll talk about is sort of sleepaway camp. There are multiple groups that would advise against sleepaway camp because you're sleeping overnight with a group of individuals. So we're violating sort of the length of time you're with them. You can't wear a mask while you sleep. You're in tight quarters. There's ventilation in those units overnight. It could be good, could be not good, hard to say. But we're violating a lot of those SMART protocols when we go to sleepaway camp. If a child is going to go to sleepaway camp, I think what we need to think about is the prep, what the protocols look like on a day-to-day basis there, and how they're doing pods. So I don't want to forget that testing is still one of the really great tools in our toolkit. Before a child were to go to summer camp, you might think about ensuring that they don't have COVID before they go to summer camp, instituting a strict quarantine before they go to summer camp, and inquiring at the campsite how they're going to address testing to ensure that if somebody comes to the camp, whether this be a day camp or sleepaway in this situation, are there people who are asymptomatic? Is there a system in place to test enough of the population to ensure that there's not somebody on site sort of seeding infection? Those are strategies that we had last summer. They're still important now. routine testing, quarantines before we go to sleepaway camp. And the last thing is pods. So, a summer camp that is able to sort of separate out their campers so that they're in consistent smaller groups. That's a really nice way to limit the infection in other groups, and that's easier to do in a day camp situation. It might be harder to do in a sleepaway situation, but those are the things that I would look at in making decisions for sleepaway camp. But again, when you're going to sleepaway camp, you're violating a lot of those smart precautions because you can't do them at nighttime in a small space. So in our other activities outside of day camp and sleepaway camp, I think it's important to make it easy to maintain the smart precautions. Children will follow the actions of adults, and so and many people are unvaccinated. So I think it's really important to lead by example with children in maintaining our smart precautions: space, masks, being outside instead of inside, restricted networks, shorter visits. And maintaining these precautions provides some semblance of normal for kids who may have underlying conditions or parents that haven't been vaccinated. So again, it's an inclusive way to move forward for maybe that family that doesn't have anybody vaccinated yet, or a parent that doesn't have time off from work, or the child that has a health condition that doesn't allow them to have those freedoms quite yet. It's really hard to say no to that big party that's planned, and it's even harder to tell your child no. So if we can plan events that incorporate these smart protocols, it's really better so that nobody's the bad guy. The other thing I think is important is, thinking about pods. So networks can get really big really fast. So maybe think baseball or swim team, but not both. Repeat interactions within one family or one event is better because we are less likely to spread an exposure that happens to baseball to all the other activities that happen in the community. A summer with nothing would be much less enjoyable than summer with one consistent venue where we're able to maintain risk precautions and enjoy ourselves. I think there's absolutely room to enjoy ourselves this summer a little more than last summer. We just have to be prudent about that.
Yeah, I mean, I've heard from so many people that this summer is actually even more challenging in terms of decision making than last summer for that reason, right? Because we want to say it's better, it's over, we can go do everything. But that gray area, there's actually a fair amount of research on this around decision making, that it's actually easier to make
way harder
in the sort of the black and white, but when you're in the gray area, it's difficult, right? And that's where we are.
Absolutely. I think the gray makes it hard, and the length of time that we've been doing this is hard. It was fun to go for a hike with just your family, in March of 2020. It's getting old and people are really tired, and it's okay to be tired. What I hope we're expressing is that, we see the light, and, the little improvements are really important. And so we're not saying forever, we're saying at this moment in time, we need to still be careful. And every day we're in a situation where it looks like, more people are vaccinated, and the weather's warmer, and we can sort of work within the precautions, and we feel the decision fatigue, trust us. So when in doubt, talk it out.
That's right, talk it out. And for the Dear Pandemic community, keep these questions coming, because this is a great way for all of us to see what your questions are, to answer them, and to continue the conversation, right? Because I think in the gray area, the conversation is even more important than ever.
Absolutely.
Right. So in fact, though we want to keep the conversation going, we are, but this is all the time we have for today. So we get tons of questions. We can't get to them all, but we do read every one of the questions that comes into our question box. And then we decide what we're going to be posting about, what we're going to be answering in next week's live. So if you have a question, please go on to dearpandemic.org, and there's a clear place for you to insert your question. And just another thank you to Bridges for the Deaf and Hard of Hearing and the CART services the closed captioning services so that we can be more inclusive and provide this information to more people. And if you were using these services, let us know in the comments. So thank you for joining us. We were going to be here this time next week on Saturday, 9:30 Central Time. Until then, stay safe, stay sane, and thank you to all of you in the Dear Pandemic community. Thank you so much, Dr. Ritter.
Thank you, Christine. It's been a pleasure.
It's been really, really fun. Thank you so much.